Geriatric syndromes. What is a geriatric syndrome? Geriatric syndromes are common health conditions that generally affect the elderly more than the regular population. They are associated with poor outcomes and high death rates. Geriatric syndromes include delirium, or sudden confusion, incontinence, or inability to make it to the restroom, frailty, or weakness, or becoming ill more easily, pressure ulcers, which are skin wounds from sitting or laying for long periods of time, and falls. Did you know that 1 out of every 3 people over the age of 65 will experience a fall in their lifetime? The risk of falling increases to nearly 1 in 2 people by the age of 80. Falls are the 6th leading cause of death and the leading cause of unintentional injury in people over the age of 65. 1.8 million people over 65 are taken to the ER every year for injuries related to falls. Of these, 433,000 were hospitalized for fall-related complications. 14,900 of these cases resulted in death. Preventing falls is of the utmost importance. Those who fall are at greater risk of losing their independence and ability to live safely in their homes. This is an issue that is greatly important to many elderly people. Additionally, the cost of falls is a significant financial burden to society. Falls that occur in hospitals cost $1.08 billion annually, or approximately $15,000 to $30,000 per fall. And roughly 244,500 nursing home residents suffer a serious fall injury annually, with costs estimated at $4.9 billion in 2005. But what can you do to prevent falling? The key elements to preventing falls are nutrition, balance, and safety. The elderly are prone to develop vitamin D deficiency because of various risk factors such as decreased dietary intake, diminished sunlight exposure, reduced skin thickness, and impaired absorption of the vitamin. Vitamin D deficiency is associated with muscle weakness and is common in elderly people who fall. According to the British Medical Journal, adding vitamin D in a dose of 700 to 1,000 units a day reduced the risk of falling among older individuals by 19%. In addition to adequate nutrition, balance and strength are equally important to fall prevention. The AARP recommends Tai Chi and strength training for fall prevention. Tai Chi is a slow physical exercise designed for relaxation, balance, and health. It is easily tolerated by the elderly and promotes social engagement as well. In Tai Chi, you practice the transfer of weight moving from leg to leg and your body from side to side. Not only does this improve your balance, it also improves your body awareness. Strength training is a type of exercise that causes your muscles to contract, which builds the strength, endurance, and size of skeletal muscle. Muscle strength is important for feeling stable when you walk and improves your balance. The AARP has 4 guidelines they recommend to help prevent you from falling. The first is to begin a regular exercise program that you enjoy. If you don't like it, you won't do it. The second is to ask your health provider to review your medications and identify ones that might contribute to dizziness, low blood pressure, or change in vision. Have your vision checked annually by a healthcare provider. And be aware of environmental hazards. A seemingly safe environment can become dangerous as one ages. It is recommended by the Aging and Technology Research Center that elderly people walk through their homes and identify potential hazards, such as lack of or unstable railing, unsafe steps that are too steep or cracked, poorly lit areas, uneven pavement or floor levels in the home, and areas where snow or ice collect where you walk. In conclusion, falls are preventable. Following these tips can help keep you off the floor and on your feet. A fall-free future is in your hands.